Hello, I'm Bruce Spurlock, a physician and health leader dedicated and committed to helping professionals and decision makers navigate change with clarity. On viral healthcare, we look at the ideas spreading across healthcare and what it takes to implement them wisely and sustainably. Now, this is my Friday reflection, the very first one, and it relates to the podcast and the taping we did earlier this week, where we introduced this concept of viral healthcare. What's it all about? First of all, I want to make really clear that it's not anti-innovation. It's not some kind of Luddite, don't use this technology or not. What it's all about is discernment, is understanding when are things going to work, when are things likely to fail, what are the differences between the two, what are the costs about all of these kinds of activities, and what should a decision maker, a leader, do to protect themselves, their organizations, and their futures about it. So we discussed this notion of what is a trend, what is a new idea. There's so many ideas going around in healthcare. Some of them are really good. Some of them are not so good. And some of them are actually horrible. Just absolutely the wrong things to do. I'm so frustrated sometimes by watching organizations who should know better make really bad decisions, jump on, look like they're grabbing that shiny object. So the question is, when have you done that? When have you sort of seen things? I certainly have. I'm not immune to the sort of natural instinct of that shiny, sexy looking, really, really appealing kind of practice or innovation or platform or system, you name it, this new idea that's coming out that we feel like we need to grab onto really quickly. When have you done that? And what have you done to learn about it? Now, one of the things that happens when people learn about making a mistake, for example, and jumping on a train or a parade or a bandwagon, whatever analogy you want to use too early, is they become cynical. I actually think that's the worst thing that could happen, because then your cynicism is not really accurate when there's a good one, when there's a new innovation that you should be adopting, where you should be changing because it really makes the world better. It is going to last. It is going to be there 10, 15, maybe even when you retire. So the idea is to have discernment about when to hold back and when to get on. And when you do decide to get on, what makes the difference between successful implementation and all of these plateaus and issues and pushback that really make those kind of change strategies ineffective. So that's what this is all about. So the first question for you is, when have you been on a new activity, jumped on the bandwagon, and kind of regretted it? I know you all have. I've done it. It's sort of the nature of being human and sort of learning our way in this leadership and decision-making process. The second thing I'd like you to think about is, when did something catch you by surprise? When did you not really notice that you were actually adopting something, and years later, months later, at some point in the future, you realize, wow, the world is different than when I was working this way, or when our organization was working this way not too long ago. So the first one is, when have you been on a new idea that's failed, and what did you learn from it? And the second one is, when were you surprised? When did you get surprised that this new idea was really something that's going to stick? I've certainly seen those. I'll talk about that in a couple of weeks when we talk about rapid response teams. And there are a lot of other examples about things that sort of kind of caught up to us slowly, but were really, really powerful and made a big difference in healthcare. And finally, I just want to ask you to think about, like, how open are you to learning? How open are you to this idea that maybe there's a better way, maybe there's a system, maybe there's a way to think about these things so that we can learn from others. We don't have to make other people's mistake. Maybe we can find the people who are really successfully adopting it, really have real tangible results. How willing are you to want to look for others and guidance from outside to be able to help you with your discernment? If you've got the solutions, if you've got the system, then by all means, run with it. But if you think that there's an opportunity for how to get better at that decision making, what I call decision quality and discernment, then join us. And I'll see you back again next week.